Welcome to week 3 of our online facilitation program for instructional video. Today in our lesson, we'll be continuing with Module 2, which we started last week. And today we'll look at Unit 2, Unit 3, and Unit 4 under Module 2. Unit 3, Occupational Accidents. Unit 4, Occupational Health Poisons. The learning objectives or learning outcomes for Unit 3 and 4 are as follows. Learners should be able to define occupational accidents, occupational poison, and types of accidents in the work environment. Describe the predisposing factors to occupational accidents. Explain the methods of prevention and control of occupational accidents. Describe the management of accident cases in occupational settings. Describe occupational poisons and their sources. And lastly, state prevention strategies for occupational poisons. As we know that the success of any occupation is measured by the progress and the safety of its personnel. For these reasons, there needs to take safety measures against occupational hazards. Nevertheless, accidents occurred and it constitutes the most important threats to workers. This problem is a costly situation because occupational accidents pose a serious problems for both the employer and the employee and also increase the workload of caring professionals like nurses. Accidents is one of the major occupational health problems while performing an activity at workplaces. Occupational accidents are viewed as unanticipated, sudden, and serious events that causes injury or even death to a person at their place of work. Occupational accidents, therefore, can cause economic, human, and material losses to both paid and unpaid occupation. What are the different types of occupational hazards that are commonly seen at job places? Generally, accidents are categorized based on types. The following are some of the types of occupational accidents workers encounter. Fall from heights, high injury, burns, wounds posture, bruises, sprain, fractures, dislocation, crush injuries, amputations, motor vehicle accidents, slip and falls, electrocution, overexertion, struck by objects, and entanglements. The precipitating factors of accidents are as follows. The causes of accidents to workers are varied. As a result, some of the causes are known while others are unknown. The known causes can happen without signs, and the following are the factors that precipitate this accident. unsafe human behaviors or human failure, environmental factors, defective machinery, and lastly, work characteristics. Unsafe human behavior or human failure. What do we mean? It is simply one of the main causes of accidents. For up to 80% of accidents that do happen is as a result of human failure or unsafe human practice or behavior. And these behaviors or human failure can be due to psychological and attitudinal factors such as anger, hatred, fear, anxiety, and sometimes joy. Environmental factors. This refers to the conditions of the work environment that can precipitate accidents to workers. These conditions include nature and man-made factors. Defective agents or machinery. This refers to poor design, manufacturer's defects, mechanical or structural failures, rusted connections, poor handling of machines and shovels and shovels and knives. What are the ways to prevent and control occupational hazard? As we know that prevention is better than cure. The prevention of accidents is an essential part of good management of any organization. The cooperation of both workers and management team is required to reduce accidents at place of work. Therefore, the following measures should be taken to prevent occupational accidents. Safe machines for workers by the employers. Adequate training of workers on the proper and important use of safety devices. Clear policy and guidelines on safety precautions for workers. Allowing minimum workspace for workers. Management of accident cases. It is important to note that the first aid should be given to all accident victims by the occupational health nurse working with an industry while waiting for professional ambulance or rescue team. Never should a should an accident victim be move, be moved away until his breathing has become adequate, his bleeding has been controlled, unless the victim's life will be in further danger. So it is an important thing to note that accident victims should not be moved from the scene until all these measures are noted. When lifting and carrying an accident victim, in order not to cause further danger, gently support the head, the neck, the back, and the extremities, and keep the body aligned all the time. Unit 4. Occupational health poison. There is a lot of concern over an increased daily hazards faced by many workers at place of work. The consequences of hidden hazards such as chemical, radiations, happen later in life. As a result, employees should be warned against these dangers. Occupational poisons are serious injury that is job related and is usually happened at the factory or construction work sites. This can occur as a result of leakage, failure of chemical, plant, or as a major accident. Generally, poison is any substance that can impair the function of the body. Occupational poisons are therefore substances, elements, compounds used in industries that interferes with the metabolic processes of the body and produces acute or chronic ill health. Poison enter the body through inhalation, injection, or absorption. Sources of industrial poisons. What are they? We have heavy metals, chemicals like strong acids, dust, gas, and fumes. Strategies for prevention. The following are some of the approaches or strategies to prevent occupational poison. Conduct pre-employment and pre-placement health assessment for every employee. Monitor health status of employees from time to time by doing periodic medical examinations for workers. Do effective supervision and inspection of industries to ensure compliance and research to establish the hazardous level of various chemicals. Continuous training on the actual work situation, and lastly, monitor the use of protective devices among the employees. The implications of occupational poisoning on the employees. There is no doubt that occupational poisons can cause disabilities, psychological depression, trauma, even economic loss, social implications on the employees. For this reason, it is important to prevent occupational accidents and occupational poisons at workplace. In conclusion, occupational accident is an unforeseen circumstances. No one ever expects an accident. It happens unexpectedly. While occupational poison is one of the hazards workers are exposed to. Therefore, unless safety are consciously inculcated into the mind of workers, there will be continuous carelessness arising from both parties, which could lead to permanent disability or even loss of life among workers, because the effect of this takes years to manifest. It is therefore imperative to train workers to abide to all the safety measures provided to them. Thank you.